Urology Speaks. We're talking today with Dr. Ann Susskind, Assistant Professor of Urology here at the University of California, San Francisco, for the topic Update on Urinary Incontinence in Women. To begin, may we have a brief overview? What is urinary incontinence?
Of course, urinary incontinence is any type of involuntary leakage of urine. Now, there are two major types of urinary incontinence: stress urinary incontinence and urgency urinary incontinence. Stress urinary incontinence is leakage associated with an increase in abdominal pressure, such as laughing, coughing, sneezing, running, jumping. And urgency urinary incontinence is leakage associated with a strong urge to urinate and you just can't get to the bathroom in time.
What can a patient do by themselves to help the situation?
Great question. There are several things that an individual can do either by themselves or before they see a doctor if they wish. One is dietary changes. We've all probably heard that caffeine can be irritating to the bladder, but there are several other foods and beverages that might surprise us, such as tomatoes and chocolate, that can also be irritating. These can exacerbate urgency type symptoms. There are also exercises that can be done, such as Kegel exercises, which many women are familiar with, and working in addition to that with a specially trained pelvic floor physical therapist to help refine those exercises. Weight loss can also be helpful for both types of urinary incontinence.
For urgency or overactive bladder, I know a lot of people are prescribed medications. Are there other options?
Yes, there are many other options. While medications are a great place to start, they either sometimes can cause unwanted side effects such as dry mouth or constipation more commonly, or they may not work well enough to improve individual symptoms. So I'm just going to mention three other types of treatment for urgency type urinary incontinence that can be considered when medications aren't satisfactory. So one of them is called PTNS, which stands for percutaneous tibial nerve stimulation, and that's a minimally invasive procedure that we do over time in the office setting. Another option are Botox injections, and those injections go directly into the bladder and can be done in the office. And finally, there's a device called sacral neuromodulation, which is sort of like a bladder pacemaker, and that can get implanted in the operating room. So there are many different options other than medications.
I hear a lot of news about mesh. What is it? And if someone doesn't want it, what are the alternatives?
There certainly is a lot of news about mesh out there in the media, and it's very confusing. So I want to start by first taking a step back and discerning the type of mesh used. So there's mesh that's used for stress urinary incontinence and midurethral slings, and there's mesh used in pelvic organ prolapse repairs. Now, while it is the same mesh, the amount of mesh and the placement of the mesh is very different in both types of procedures. So the majority of the problems that we're hearing about in the media are related to the mesh used in the pelvic organ prolapse repairs. Mesh used in sling procedures for stress urinary incontinence, however, continue to be the gold standard procedure for straightforward stress urinary incontinence in women, and they continue to be supported by all of our national organizations as such. Now, if a woman doesn't want mesh, or if the situation calls for a different type of procedure, there are other options. So a couple of these options are, one, urethral injections, which can be performed in the office setting if a woman wishes. And the second option is a different type of sling where we actually use the woman's own tissue called fascia, and that's called a pubovaginal sling. So there are a lot of different options for treatment of stress urinary incontinence.
So these issues can be very sensitive. What's the best way to talk to your doctor about this problem?
Absolutely. And I really see it as my job to make sure that each woman who comes to see me is comfortable talking about these problems, because I understand that they are very sensitive and emotionally charged. So it's my job to make the woman feel comfortable so that we can have a candid conversation, so I can really get to know her and understand what is important to her, what are her treatment goals, and what does she want to have done. So really only by this conversation can we select one of the many different treatment options that we talked about today, and so that it is the right option for each patient.
Wonderful. Thank you so much for your time in this update on urinary incontinence in women.
Thank you very much.